Genetic counselors are health professionals with specialized graduate degrees with expertise in the area of medical genetics and counseling. What do genetic counselors do? So the activities in our jobs include things like taking family histories, examining medical records, analyzing inheritance patterns, gathering information about the client or the patient. I'm going to use those words sort of interchangeably, and providing support and information back to the patient. Some of the things they might be concerned about might be a birth defect, either in the family, a concern about one, a known genetic disorder, an undiagnosed condition, but they always have some concern that they come in with. You'll notice, I think, that I highlighted the word risk, and that's because defining risk is a large part of what genetic counselors do. So for example, let's say somebody had a child with a genetic disorder. They want to know what the chances are that when they have another child, the child will have the same disorder. So the chance could be 50%, or it could be 25%, or it could be 1%. And so it's figuring out that risk and explaining it to the person so they understand it. Another example with cancer genetics, which I'll talk more about, which is very popular now. The chance for a woman to develop breast cancer, depending upon genetic testing results and family history, could be 70%, could be 80%, could be 40%, could be the same as anybody else in the general population. And that's the calculating risk and helping people to understand their risk. Available options for people will usually, genetic testing will usually be one of the options that people have. So with the advent of newer, cheaper, rapid DNA sequencing, and a lot of you have all of you had molecular biology? Yeah? Okay, so you know all about these new methods for sequencing genetic DNA. And with the whole genome sequencing and whole exome sequencing and DNA screening chips, there is just a wealth of DNA information that's available. And the expertise in genetic testing is even more important today than it was years ago when we started out. There wasn't any genetic testing. So how all this genetic information is going to be used, it's going to be up to genetics in the healthcare arena. I mean, it's going to be up to the genetics professionals to figure out, because it's not straightforward. It's difficult to interpret genetic test results, and it's going to take a long time to sort out how do we use all this genetic test results. You may read or hear, we can sequence a whole genome. We're going to have the answer to everything. It's just, trust me, it's not going to be that easy. So far, what I've been talking about are providing clinical services, which is what most genetic counselors do. Or at least almost all genetic counselors, when they started out providing clinical services. And one thing I put down here is that genetic counselors fall into the category of ancillary health professionals. So in the medical world, that's what genetic counselors are considered. And I always tell people, if they're considering a job in genetic counseling, that they should understand the hierarchical organization of the medical world. That physicians are at the top, and they always have the final say, and a genetic counselor is always going to be an ancillary health professional. Even though the role of genetic services is typically not well understood, still physicians have the final say. Now that I've given you that warning, I have to say most genetic counselors are well respected, have good jobs, have a fair amount of autonomy. But this is something that anybody going into this field should be aware of, how it fits into the medical world. So for those who love genetics, there are different types of professions in genetics you might want to consider. All the professions listed here are people who do them can be called geneticists. So first, the medical or clinical geneticist is somebody who's a physician. So their training after the bachelor's degree, of course, is medical school plus a primary care residency plus a medical genetics fellowship. So we're talking many years of education post-bachelor's degree. And as physicians, they have the authority to diagnose patients, to treat patients, and to test patients. So another category of genetics, which I think you're going to hear about, might be, I put down PhD geneticist, but it could be somebody with a master's degree or a bachelor's degree. Certainly can be considered a geneticist if they work in a genetics lab and they're doing research. But even if that person is working on a genetic disorder that affects humans and they know a huge amount about it because they're not in the medical world, they cannot diagnose or treat or test. Now, a genetic counselor kind of falls in the middle with a master's degree. We do work with patients, and depending upon your state licensure law, in Illinois, we may order genetic tests, but the state medical society has made sure that genetic counselors cannot diagnose or treat. So that's how we differentiate these different categories of geneticists. So some of the other things that genetic counselors do, certainly helping families cope and make decisions. Decision making is a big topic in graduate school when you're training to be a genetic counselor. Serve as patient advocates and providing education. I think almost all people in genetics see themselves as educators. And in the medical world, as I said, the role of genetics is not well understood. So that's one of the reasons why genetic counselors and geneticists see themselves as educators. We educate the patients, help them learn about risk reduction strategies, depending upon whatever the concern is. We serve as a resource in the medical world for other healthcare professions and for the general public. Now, I'm wondering if any of you can think of something that I didn't mention that genetic counselors do. And you guys are all way too smart for this. What I'm thinking of is that many times when I have told somebody I'm a genetic counselor and they're not familiar with it, the first thing they ask is, oh, so you tell people whether they should have children or not. Or you tell people if they should have an abortion or not. And the answer, of course, is no. Absolutely not. I talked about the autonomy of the genetic counseling job. We're very protective and aware of the patient's autonomy. We offer people options, but we absolutely do not tell people what to do. It turns out we have had patients come in where a physician who's not a geneticist has told people what to do, but a geneticist would not tell a patient that. So I think almost all genetic counselors providing clinical services specialize today. And these are some of the areas, just because there's so much that to be a generalist is almost impossible. So almost everybody specializes now, working with patients during pregnancies or before pregnancies, pediatric patients. To work with pediatric patients, you really do need to work with an MD geneticist because of the fact that the pediatric patients require diagnosis and treatment often. So I just mentioned a couple of the conditions that they might be at risk for: sickle cell anemia, deafness, mental retardation. There's obviously a huge long list. The most common pediatric patient that comes into a genetic clinic has developmental delays and no diagnosis. It's not explained what the reason is for the developmental delays. Clinics where adult patients are the primary patient are more rare, but they're becoming more common because there are a lot of adult onset conditions such as neuromuscular degeneration, Huntington's disease, Alzheimer's disease. Cancer genetics, that area has exploded in the last 10 years for several reasons. So what those clinics focus on is inherited susceptibility to cancer. And one of the reasons that's become accepted in the medical world is because you probably know that for breast cancer, colon cancer, most prostate cancer, most cancers, there is screening available. But if somebody has, come on in, an inherited predisposition to one of these cancers, their medical care changes. So that's why cancer genetics has become extremely big. So where do genetic counselors practice? Just where you would expect. Mostly in the bigger medical centers, where in clinics or hospitals. Some work for doctors. They're often in academic centers, which they might have, the university, Associated University might have a genetics department. So you almost always find genetic services at big academic centers. Independent practice is possible for genetic counselors. Not too many people do it for a variety of reasons, but it is something that's available. The next 3 slides go over some of the things that people do before an appointment and during an appointment and after an appointment. And I'm going to kind of skip over those slides. But I just wanted to note that what a genetic counselor spends his or her time doing varies tremendously. And it varies depending upon where the counselor works, depending upon the type of patient, the indication for the appointment. And there really isn't a typical day. So I said I would kind of skip over the typical things that we do. We can always come back to this. When I said there isn't a typical day, that's for the genetic counselors who do provide direct clinical services. But there are increasingly more jobs available for genetic counselors that are not providing direct clinical services. The genetic counselors have the skills that can be used in a variety of different positions. Of course, the knowledge about genetics and genetic testing is extremely important, and they're hired for that knowledge. But also, genetic counselors, especially if they've worked in a clinical setting, understand the needs of patients and understand the difficulties that many of the patients face. They've had to develop good organization skills, good speaking skills, writing skills, good communication skills in general. And so there are other types of positionings that are opening up. One is most state departments, I don't know if most, many, Illinois for sure, but many state departments of public health will employ in the State Department of Public Health a genetic counselor whose job is going to be to raise awareness of genetics, improve access to services. One of the things people in genetics talk about, and this is true of other fields in medicine as well, is that access for people, if somebody lives in a small town in central Illinois, they don't have access to services. You need to go to where the larger center is. So outreach services are something that the Department of Public Health will see is their position. To determine public policy, things like newborn screening, somebody working in the Public Health Department would work on that. Education, again, in teaching in the genetic counseling programs would be something that some counselors do. Many of those counselors see patients as well. There are limited teaching in colleges and universities, but as you know, most colleges and universities want PhDs to do the teaching there. There are research positions available to serve as a liaison between the research lab and patients who may have donated their tissue to a research lab working on a particular condition, and to do research on genetic counseling questions as well. These are the areas that I think there are more of what I call the non-traditional jobs, meaning not providing direct clinical services. Pharmaceutical firms will often hire genetic counselors because they want the genetic expertise, and probably they can hire a genetic counselor who has a lot of genetic expertise for less than they can hire an MD or a PhD, but that's another issue. Diagnostic labs that offer genetic testing always will have a bank of genetic counselors available. As I said, genetic testing is not well understood in the medical world, and so if a physician knows that there's genetic testing that may help with their patient, but they don't know where to start, they may call up a lab and say, okay, how do I test for this? And so genetic counselors, almost all labs have a number of genetic counselors work for them. There are internet companies. Have you guys heard of, there's one called 23andMe. There are several others as well that are direct-to-consumer testing. They all have genetic counselors on their staff. There is very little, I think no regulation today. As a matter of fact, genetic testing has been developed so rapidly that there isn't really federal regulation for genetic testing, and that's going to change. How it's going to change these internet companies, I don't know. There are other internet companies that have their special niche as working for physicians who want to order a test for a patient, and so the counselor on the phone will be the liaison between the doctor who's going to order the test. They're going to talk to the patient, get the medical history, and figure out the appropriate genetic test. And then also, when the testing is done, interpret the testing. So the doors are opening in many different directions for people who have this expertise in medical genetics and genetic testing. So what's the education required for a genetic counselor? It's a master's degree in genetic counseling. And in the country, there are 30 different programs, genetic counseling programs today. These programs are intense, as I think as probably they should be. There's a lot of coursework. The students in the program rotate through different clinical sites to see what a cancer site would be, a place where they see a lot of pediatric patients and so on, and typically they require a thesis. Once somebody graduates, there is a rigorous national certification exam. So this is analogous to the boards that physicians will take. And then they need to maintain their certification. Many states, including Illinois, a person has to be licensed in order to practice genetic counseling, and you have to have your certification to be licensed. And you always have to do continuing education. That's part of it, what we do. It's always there, because it's always changing. We always have to learn more. So I wanted to tell you some of the pros and cons of the job. And there are a lot of pros. I think it's a wonderful profession. There are a lot of opportunities. It's a profession that a lot of people have said that they've gone into because they really like science. They're really interested in science, but they want to work with people. And so it's a wonderful way of combining those two diverse interests. The formal education, if you compare it with a medical geneticist, where you might be talking about 8 years after your bachelor's degree, 2 years after you graduate, you can have completed your formal education and go on and start working as a genetic counselor. And something that's hard to explain unless you've done it, and many of you who have volunteered and working with people will understand this, it's a privilege to work with people on these sensitive issues, things that mean so much to them, and to have them share their life with you. And I don't think I ever got over thinking what a privilege it was to work with people. And I guess this is similar to people will say, well, if you're in a helping profession, if you're helping people, there are rewards. And there are rewards for helping people, for being in that type of a profession. Another reward of the profession that I think is wonderful is the continuing intellectual challenge. We're always learning. Every time you see a new patient, you really have to think, okay, what's new since the last time I saw a patient for this indication? And we're continuously learning. There are a lot of opportunities for personal growth. I know people are always interested in average salary. So these figures are nationwide. They're going to vary a little bit from area to area. You can see that you're not going to strike a pot of gold as a genetic counselor, most likely. And there are some jobs, people who are maybe working for a genetic testing company and they're a manager and supervising lots of people, or heading the director of a genetic counseling program. Some of those jobs are up over 100,000, but not a lot. That's sort of what the limits are today. So these are the rewards. There are some downsides in that you have to be careful what job you take because the jobs vary so tremendously. And some jobs there's a lot of autonomy, and some jobs there's very little autonomy and not very reasonable people that you're working with. This is probably true of any job. You have to be careful what job you take, right? Genetic counseling, many positions in the medical world can be emotionally draining. Those pediatric patients that have a storage disease and are going to keep losing their faculties and grow up, and what's facing them is just downhill and death in their early teens. It's really hard. It's really hard to work with that. And there are some people who feel they just can't do it anymore. As I said, there are lots of medical areas that's true. In pediatric oncology, I've always thought would be an emotionally draining field. And then I think I already mentioned this, the rapid advances in the field mean you can't just rest and relax and figure, okay, I know this, because things are changing constantly, that you constantly have to do research. So that's both a pro and a con. In genetic counseling, so far, there are a few career ladders. And by that, I mean, if you think about going to work for a company, you may start out at the entry level and move up to be a manager, and then maybe move up to be a supervisor, and then keep moving up through the ranks, become a division head. Genetic counseling really doesn't have that sort of career ladder. There are some centers that have a handful of genetic counselor, and one of them will be designated the manager and will be paid more for doing that. And some of the positions in industry with the companies, I think they can be given different titles that will give them more cachet in genetics. And this is likely to change. As I said, this is still a relatively young field. The other thing is, if you decide you want to get a job in Springfield, Illinois, well, guess what? You may not be able to. Most of the jobs are in the big city. You can't, or if you wanted to get a job in Macomb, Illinois, no way. So people going into this field, it's best if they go into it with the idea they'll be flexible about where they're willing to work. So what should you do if you're interested in genetic counseling? So here's a list of the coursework that you probably should have. Molecular biology, chemistry, of course, statistics. Remember, you have to be good at doing a risk analysis. It's good to do research always. All of the genetics field is based on research, of course. You might consider psychology, physiology, anatomy, ethics, human development. It's good to gain experience working with people, and for people applying to a genetic counseling program, it's good to be able to have that on your application, that you've had experience working with people. I think they want to know that somebody is comfortable working with others. And I listed some possible places where one could volunteer. Being a teaching assistant, research assistant, dorm assistant. You know, you're working with people, you're in a leadership role, those are good things to do. As you do these things, if you're thinking about applying to a genetic counseling program, think about whether the person you're working with is somebody who might be able to provide a recommendation for you. So when you get ready to do that application, you have some people that you can count on to give you recommendations. There's lots to read about. Human genome research, the new sequencing methods, ethical dilemmas. There are lots of ethical dilemmas. I could spend a whole lecture going over ethical dilemmas in genetics. About genetic conditions, what it's like to live with a genetic condition, to grow up, to have children, knowing you might pass that on to your children, to be thought of as different. There's a lot of things to read about what it's like living with disabilities. The National Society of Genetic Counselors has a website with the acronym NSGC. They have a lot of information. There are a few genetic counseling internships. I think Northwestern in Chicago has some one-week summer internships, so they take a number of different people over the summer. Interviewing genetic counselors is another way to learn about the field, except you'll ask them, so what's your typical day like? And they'll go, I don't have a typical day. Again, what they do could be very different. And so one last thought I want to leave you with is that genetic counselors pride themselves on being tolerant and sensitive to the needs of others. And based on that ethos, we try to reach out to all and believe that in doing so, we help reduce health disparities. That's just one of the things that we're aware of and that we try and do. We need genetic counselors from a variety of ethnic, racial, and cultural backgrounds. And I put down here at the end, there's a special need to provide genetic counseling services to African American, Hispanic, and other underserved communities. And in downstate Illinois, it's some of the small towns. I used to work at the College of Medicine in Peoria, and we would go out to the health departments in some of the small towns, and they were underserved, very little knowledge of what was going on with them. So, in summary, this is a wonderful, exciting profession. There's lots of opportunities, and the outlook for jobs today is good. So.